You're listening to Clinical Connections, the Zepf Center podcast connecting you to the latest clinical topics. Welcome back. We're glad you tuned in today. May is an especially busy time in behavioral health field as we celebrate Mental Health Awareness Month. Observed since 1949, this month serves as a time to raise awareness, reduce stigma, and remind people that mental health is just as important as physical health. But as many of us know, awareness alone isn't enough to create real change. Change happens when we create space for honest conversations and make it easier for people to seek support without fear or judgment. Today, we're joined by two dedicated Zepf Center leaders, Clinical Manager of Integrated Care, Melanie Martin Ebel, and Medical Director, Dr. Thomas Roach. Together, we'll discuss the current state of mental health, the barriers that still prevent people from getting care, and how we can work together to break down stigma in our communities. We'll also take a closer look at some of the innovative services available here at Zepf Center, including our first program, which provides early intervention and support for individuals experiencing their first episode of psychosis. Whether you're someone seeking support, supporting a loved one, or simply wanting to better understand mental health, we're happy you're here. Welcome to the studio. To start off, can each of you share a little bit about your role and the work that you do here at Zepf Center?
Yeah, I can go ahead and get started. My name is Melanie Martin Ebel, and I am one of Zeff's clinical managers of integrated care. I work with our adult mental health case management team. And within that integrated care component of mental health treatment, our team works and serves individuals and also connects them with other treatment providers to make sure that coordination of care is happening, advocacy, skill development, and also helps to really empower and then promote and teach independence within each individual's community, their home environment, and their daily living. My role is to work with that team. We have about 25 case managers in total to make sure that they have the clinical support that they need, the training, and the tools so that they can continue to provide those services in the best way possible.
Great. Welcome, Melanie.
Hi, I'm Dr. Roach. I'm a psychiatrist here at the Zepf Center. I mostly work at our Nebraska location, but I also happen to be the medical director of adult outpatient. And so I kind of see patients from, I think, 8 to 4:30. But I kind of do a little bit of everything. I am happy to say hi and be placed wherever to do whatever we might need for any one person that day.
Welcome, Dr. Roach, and thank you for your flexibility. This episode is especially important as we observe Mental Health Awareness Month. Why is it important to have these conversations, and what do you wish people better understood about mental health today?
I have a lot to say here, but I think for me, I think we all have mental health, and I think to say that it's as real as physical health. And I think the burden of having mental health is that it's invisible. It's like this invisible garden that you have to tend to all the time. And so you can have a nice garden for sure, but no one's garden is going to be the way it needs to be unless you actively put some thought and effort into it. And so that's what makes it kind of tricky because, if you have let's say an injury physically, you can see that, and there are all these obvious things to do, but everyone's garden looks a bit different, and we don't know what everyone's garden looks like, and so what someone's garden might need is completely different from one person to the next.
Yeah, and I would just add to that because I think what Dr. Roach is talking about is that complexity of the brain, and we are learning so much more about the brain, how it responds to different life experiences, trauma, and that emotional impact that really can impact so many different things in our day-to-day life. And so that spectrum, right, like with our mental health, just like our physical health really is a spectrum. And some days we're more mentally well than other days. And that really creates this importance about really learning how to take care of our emotions and our thoughts and the impact of our experiences, or that tending to that garden, and what do we each need to be able to do that and to make sure that we can flourish in the best way possible.
Even with more awareness, many people still struggle in silence. From your perspective, what is the reality of the mental health needs in our community right now?
I would definitely say that mental health needs in our community are expansive and expanding. There are so many more potential for impact of trauma right now, especially in today's social media age. You can't just experience something for a moment. It ends up oftentimes being put out there to everyone forever. And so that can carry a lot of different emotions, feelings, thoughts with it. In addition, like graphic real life footage regularly just pops up on people's feeds as they're scrolling. And so now these things that maybe they wouldn't be impacted by, they're getting exposure to on a regular basis and constantly, And so I think it's so important for us to be mindful of that impact and to recognize that that keeps expanding the need for mental health awareness.
I'd like to add that the demand is almost always going to outstrip the supply. And it's really intimidating if you're struggling or having difficulties in any regard about, what you're struggling with and where to go. So many of us will say, I have, let's say, for example, anxiety, or I have depression, or I might have PTSD. And then it's not really clear when you have those difficulties, where you need to go at what moment in time. For example, do you go out across the street to a clinic? Do you go to a hospital? Do you need therapy? And there isn't necessarily like a guide like you would have for a PCP where it says, hey, I think you need A, B, and C. And usually if you go out and you say mental health help in Toledo on Google or Ask Jeeves, if that's still a thing, there's so many things that you can read, and it's completely intimidating if it's your first time being exposed to those problems online.
Well, stigma continues to be a major barrier. How do you feel stigma shows up in real, everyday ways for people that we serve?
Well, I want to say it's like super, super sneaky. So it's mostly, I'd say for me, in the way that we use language for very common medical things. And so hear me out here for a second. If you have diabetes or you have high cholesterol, you would never tell those people to just kind of push through your diabetes or push through, your blood pressure. That would just end catastrophically. And so there are targeted treatments for those conditions. And, by extension, let's say that you might be on methadone or Suboxone or anything where, you require a specialty clinic. The language that I commonly hear is that this person's urine, was dirty and et cetera. And so we could, for example, just say that they were positive for XYZ. And so it's those really subtle things that really kind of add up to a global whole here. And if you're listening to this and you've worked anywhere else before, like a big hospital or a clinic, more often than not, you won't even be seen, by that clinic. Usually, if it's mental health, the most common thing I heard at places I've worked before is like, I think the care here is great, but I don't want to be seen by someone here because, to be labeled with something, even though you work in the field, is far too commonly told to me that, I get the stigma, but I don't want to be seen here. And so I hear that pretty often, no matter where I go.
In my experience, so for many years I provided a coping with distressing voices training. And in that training, we used simulated interactions that were really meant to kind of mimic what individuals with that symptom might experience when they were out in the community. So during these interactions, the individuals who were kind of role-playing during that were meant to really approach it in a very non-empathetic way, lacking patience, some of those things that we really hope are not present in a treatment center, right? And it was really to just show that resilience that is needed to really manage those experiences and that stigma that's going on in the community. As a part of that training, we would also have a consumer panel join, and they would talk about their real life experiences, going into an emergency room for breathing complications, for example. And the moment that they started sharing about the medications they were taking, their diagnosis, they were told, hey, you need to change out of your clothes. Here's these paper scrubs that you need to put on. And a guard was placed at their door with the assumption that there was going to be a mental health crisis presenting. These are things that, working with individuals in the community, I've actually experienced those face changes when someone mentions that they're on some type of medication, when we're out at a doctor appointment, or even just talking with someone else in their life. family members using just certain terms like crazy, or telling an individual when they're upset, oh, just go take your meds, that'll fix everything. Those types of things show up all the time. Also in media, movies, a lot of the portrayals are not positive. They are really very negative and stigmatized as well.
How does that stigma impact whether someone actually reaches out for help or delays getting the care that they need?
I would say in so many of the people that we serve here, I think the most common thing that I hear is, I didn't know it was that bad, or I'm fine. And I imagine for those, again, who are listening here, the most common thing that we all will hear in our families or in our circles is, I'm fine, or it's not that bad. And so that usually is true. There is usually, though, some tipping point at which the whole experience of living life and eating and showering and talking becomes somehow unbearable. And that's when, the I'm not bad goes, oh man, I never knew it was that bad, right? And so the problem that I see so often, or the difficulty I see so often, is that people are so afraid to say, I have reached that tipping point at which I was unable to muster up the courage, the resources, the effort, that I couldn't overcome this myself. And that's kind of, I think, what so many of us end up hearing with not only our friends, but also our loved ones.
And I would say just that fear of judgment, a lot of times when people are experiencing mental health struggles, they're in an age range where the thoughts and judgment of their peers is one of the most important things in their life. And if they believe that they're going to be judged for seeking help or for their mental health symptoms, that really can stop them, which creates then a bigger struggle, because the research continues to show us that early treatment can be the biggest impact for success and being able to move forward and reaching, your highest potential and quality of life.
Absolutely. When someone does decide to seek help, what are some of the biggest barriers that they face?
I will say, because this is something that we see in case management all the time, but insurance and financial barriers can be so significant. We are kind of fortunate in the Toledo area in that there is a large access to sources and treatment centers, but there are a lot of rural areas that are not as fortunate to have that. So also location can really impact availability for services, transportation. Not all insurance coverage even covers all of the different services either that one person might need. And so I do think those things create significant barriers.
Zepf Center offers a wide range of services. Can you walk us through what support looks like for someone coming through our doors for the first time?
One of the things that I love about working here is that we really meet you where you are. So whatever it is within reason, we have that here for you. And so whenever intake is done, we find out where you live, how your transportation is, whether or not you need therapy or access to case management, whether or not you want medication management or psychiatric services. We kind of have everything. We have the whole kitchen sink approach over here. And so that's what I love about working with this population set too, is that no judgment. No matter what you have or don't have, we are always here for you.
Yeah, and I would just say depending on the service, when individuals come through intake, then they are going to get referred to those services that they need. Once they're coming into services, they're going to be kind of assessed for all of those different areas of need so that we can make sure that, as Dr. Roach was talking about, meeting them where they're at and really understanding what those needs are, how we can help, how we can provide that support. The intake process in and of itself can sometimes be overwhelming for individuals. They're walking in, they're being asked a lot of questions and for a lot of information. And so I think then getting people connected to care pretty quickly after that then really helps us to maybe start breaking down that process a little bit and reducing that overwhelmed feeling by really being able to begin building those supportive relationships and ensuring that we know what they need and how we can support them. Additionally, as part of our intake process, we are really looking at, from that moment they walk in the door, what resources do they have from an insurance and financial base so that we can start that process of getting them connected to those things immediately.
Great. How does Zepf work to make care more accessible and reduce those barriers, especially for individuals who may feel hesitant or unsure?
So I would say one of the biggest ways is that Zepf provides intake opportunities 7 days a week. So regardless of the day of the week, if somebody is ready to seek care at that time, they are going to have opportunities to be able to do that. Additionally, when people come in through intake, we are providing those referrals right away, starting to connect them with those financial aspects, those insurance aspects. We try to really assess our treatment team needs so that we have enough providers in all of our service areas to reduce any potential for substantial wait time to get access to care, because sometimes that can be frustrating. When someone is ready for care, they are ready.
Couldn't have said it better, actually, there. I was thinking we have several. So whenever you're a potential new person to our organization, I think in working with so many different clients and patients over time, everyone thinks that you have got to come in like 8 to 5, and most people work, and it's really impossible to get in. And you said it so great, Melanie, is when someone wants care, it's never at a convenient hour. They want it then and they want it now. And so we have 2 great avenues for that. One is we have the psych urgent care. That will help bridge you between visits. And we also have a crisis unit that is staffed 24/7. So it could be any holiday, it could be any weekend. And if the worry is that you couldn't possibly wait until Monday when you have to work, there isn't really a better time than to seek care through one of those avenues.
And I would say those things are so important, right? Because a lot of times when people are starting to seek care, it can often be at those crisis moments. And so having those opportunities available in crisis care available for them at any time is substantial to getting them bridged.
Yeah, it's pretty unique for us, actually, because most places, if you're going to any clinic, whether it's private or not, in this neck of the woods, in Toledo at least a 2 to 3 month wait anywhere you might go. And so I'm always surprised, but most people know this already. Even before they set foot into any of our doors, they always expect it to be, I didn't have to wait 2 or 3 months. Usually we can get them in pretty quickly.
Can you talk a little bit about the importance of integrated care and how addressing both physical and mental health together improves patient outcomes?
One of the worst things that can happen if you're someone who goes and you see a primary care doctor is that you might see them and they might refer you out to specialist A and specialist B and specialist C. And so that doesn't sound that bad, except you have to then coordinate the transportation. You have to hope that they have appointments at each location within a timely manner. And then getting all 3 heads to talk together in one fell swoop is really daunting, especially when, in this day and age, it's not easy exchanging information with any clinic that doesn't have the exact same system that you have. And so one of the best ways to kind of get really good cohesive care is to have everything under one umbrella. So usually, for example, in primary care, if someone is being seen for a wellness check or an annual, often they might do a depression screen and then say, you may or may not, be depressed or have anxiety, and then they might refer you out. That could take forever. Just the barrier of having the referral and going to a different building is, for me, working with primary care, a huge burden. I myself just love walking over and knocking on primary's door, whether that's Adam or Christine, saying, "Hey, you have a minute?" And that knowing that they are there in person leads to way better outcomes. I think this last month I talked to them personally about 5 or 6 cases, and it really made the difference. Because if we were not in the same building, if we were completely miles apart, there is a lot more friction in getting their attention. You have to wade through a phone tree. You kind of have to catch them when it's convenient. But if they're in the same building, super easy. And all the data shows when 2 people or 3 people talk literally in the same room together, the outcomes are way better for the people that we serve. So I love that we do that here.
Yeah, and I think that is such an important thing that we are able to provide for individuals, because the reality is that our mental health and physical health do not exist in a vacuum. They are going to have a profound impact on one another, and it can be really difficult to see improvements in one area if we aren't addressing the other one, or if the other one's being ignored. When someone has their mental health is poor, there often are physical health impacts that develop as a result. So a lot of times with individuals with mental health diagnoses, we are going to see comorbidities of things like hypertension, high cholesterol, diabetes, and all of those things are important for us to be really addressing, to be able to also address their mental health as well.
So true connected care really is best practice. Dr. Roach, I'm sure some of our listeners aren't really clear on what we mean when we talk about psychotic disorders. Can you tell us a little bit about what a psychotic disorder is and how does somebody develop one?
Great question. I would say, you can start by having a psychotic disorder just from birth. So it's in your genes. So, for example, the diagnosis bipolar 1 disorder is 1%, and bipolar 2 is anywhere between like 1 and 5%. And so that's kind of baked into your genetics. And so usually if you might have one of these conditions, for example, or schizophrenia, you might live a completely normal life. And then around age 15 to 25, somewhere in that, as I would call it, the prime window, you experience this colossal amount of stress. And so that can just be from emotional hardship. You could smoke a little bit too much weed, and that actually kind of brings out the first episode psychosis in many of the people that I serve here. And then it can come out psychosis in such a way like voices, right? So you might hear things that you wouldn't otherwise hear or see things that you wouldn't otherwise see, or start having delusions. And so beliefs that you couldn't exactly substantiate with facts or proof. Somehow, I would say you just know this to be true. For schizophrenia, too, it comes out as voices, it comes out as delusions, it comes out as things that you might see, or it might come out as disorganized thinking. So, for example, when a lot of us talk together, we have a question and there's like a direct answer. There's a pretty clear path from A to B. But in schizophrenia or any other type of, I'd say, psychotic process, you don't always have a very clear shot from A to B. You might go from A to C to F to Z, and you may never ever make it to B. And what's really jarring, if you're the person who might carry the diagnosis, is that you have no idea that you've not made it to B. You are so confident that you've made it to B, and as you exchange conversation with someone else, you're bewildered, understandably so, why they can't seem to understand you. And so from your perspective, nothing is wrong, but for everyone else is suddenly telling you, hey, are you okay? And they're trying to hospitalize you all of a sudden, and it's pretty difficult to know. All you know basically at that point in time is that you don't feel safe.
One of the innovative programs we offer is our FIRST program. For listeners who might not be familiar, what is first episode psychosis?
Yeah, so the first episode program is designed for individuals who are experiencing symptoms of psychosis for the first time, or they are new to a diagnosis that includes psychotic symptoms. It really aims to provide increased collaboration, care coordination, and evidence-based interventions for individuals in the program, and at an intensity that is appropriate for the individual's needs and presentation. The overriding goal is to get individuals linked to effective treatment interventions and those specially trained treatment providers to make sure that they're receiving those early recovery opportunities. Because as we talked about earlier, the sooner someone gets care, the greater potential they do have for improved outcomes. So it really can be beneficial because it brings those providers together. They're working closely together and really allows them to focus in on symptoms that sometimes can also carry the most stigma with them as well, and can also lead to profound negative impacts when left untreated.
Why is early intervention so critical when someone is experiencing psychosis for the first time?
Catching it early is completely the name of the game. I was just thinking earlier, it's not that different than being told when you're young to take advantage of your brain while you still can. So for many of you, it may be trying to learn a different language, or trying to go to after-school sports or play the piano, or something that really actively engaged your brain. The more that you engage it, that completely changes the trajectory of your entire cognitive life. And so, for example, if we are able to catch someone who is having their first psychotic break, we have every chance in the world to involve the family. We have every chance to educate the family, to tell them that this was not your fault. This was nothing that you could have prevented, and we can have the chance to educate both the client, the patient, the family on what next steps are. How can we prevent decline or exacerbation of your symptoms? And for me, that means that you get to keep your working brain as long as you possibly can. One of the worst things that I hear all the time for schizophrenia, especially, is that people often think that once you have the diagnosis, you're going to kind of decay into this person who talks all the time. You'll end up on the street, you'll lose everyone. And that, in my experience, is just really bad stigma and couldn't be further from the truth.
Well, and I think the other thing is, in addition to those symptoms, when those symptoms go untreated, the symptoms exacerbate, but then they can also exacerbate biologically based impairments. So they really start impacting things like attention, memory, someone's ability to just really connect and have relationships, right? Some of the things that we see with individuals who have been untreated for a period of time is a lot of isolation, removing themselves from situations that are making them uncomfortable. And as that happens, it starts to really just trim back those neural pathways for those things. And now they're left not just learning how to manage the symptoms, but learning how to rebuild that ability to even just socially connect, remember things on a day-to-day basis, and actually just pay attention to things.
What makes the first program unique compared to more traditional mental health treatment?
So with the first program, there is significant training that every individual provider that is on that team goes through to be able to really look at, again, learning those evidence-based practices and that model of collaboration and consultation. Additionally, the program looks at not just the individual, but also the family, and provides a lot of additional family support, education, and being able to really bring all of that in to that treatment model, which can be really important because, again, if the family or if that support isn't present, individuals are going to have a more difficult time really being able to manage and do what might be needed for them to have improvement. And so those things really make that important because they are built into what we do and are a part of that the whole way through.
Couldn't agree more. Having a support system, a support network, a friend or family that knows your condition or the patient's condition and what to look for when things go south is, for me, everything to ensure a good quality of life there.
What kind of impact have you seen this program have on recovery and long-term outcomes?
So we currently have a few clients who are involved in the program who have been able to use the treatment support and tools to go on and reach just different goals like higher education, having relationships renewed with family members, with their children, being able to work, being able to address debilitating like health outcomes as well that they're experiencing. So those things, I think, are significant in their lives.
I was going to say the exact same thing. Every chance that we have to see someone early and get their family involved and get them not just the client and patient aware, but the families aware of what the condition is too, the greater chances that we have at reintegrating them back into our community so they often hold meaningful employment. They're able to have families, and so many patients that I see often do bring their families in with them, and we go over together like what to look for and how we can help the person best succeed.
That leads into the next question. When we talk about reducing stigma, what does that actually look like in action?
So I want to talk about just patient forward language. And so some of the things that really like grinds my gears, just to quote that from the 80s, is that people say, oh yeah, this person over here is a schizophrenic, or oh yeah, they're an alcoholic. And so I think that's so like not cruel, but it deprives the person of their humanity. This could be a wife, a husband, with their own family. And I don't think they go home every day and say, golly, I am a schizophrenic, or golly, I'm an alcoholic. They have their own realities like the rest of us do, and I don't think they like to be identified by those words, first and foremost. So I think, like I said earlier, about it's the subtleties, right? So you can't just muscle through diabetes, for example, really make a big difference. And then I'd say second, just having the courage to say, like, I am not having a good day, and that is also okay. And I think in the climate that we're in culturally, with the rise of so much social media, there's all this pressure to look perfect all the time, to look poised and at your best. And in reality, that just sets us up for more I don't want to say disappointment, but that makes it so hard to be human, like all of us have our flaws and our problems, and I think that is to be celebrated personally than to hide away. And if I can say one last thing here, I feel like whenever we're talking to people about how their day is going, or if we're meeting someone for the first time, whether it's just on the streets, as a passerby or in clinic, so much of our language is super important. So if someone comes in and says to me, I've got this going on, I've got this going on, I've got this going on. And so often we're all so desperate to say why, or like, what's wrong with you? And so I think much better language is, oh yeah, like how come? Like how did it become that way? Or what's that like, right? And so to kind of have them spin their story for you, to illustrate, what it's like to be a person in that body for one day is way more important than saying, oh yeah, so you got insomnia. How bad is it? Rather, like, tell me about your sleep last night. What was it like for you is way more useful than saying, so I guess you can't sleep then.
And I think part of, those conversations we're having with people, it's about advocacy, education, and training, and really teaching people to be able to do that in their own lives as well. If we can teach others to be able to really share and step up when there's something that's going on that is stigmatizing and say, hey, let's do this differently. Let's talk about this differently. That is really going to allow us to get to a space where more and more individuals are doing that. And I think it really, it can start with that early education and how we're even talking about mental health with our children, acknowledging it with our children, paying attention to it, supporting it, nurturing it. Those things are extremely important to allow them to have a good understanding, but then to allow them to take that understanding into all of their interactions as well.
For someone listening who may be struggling but hasn't reached out yet, what would you want them to hear?
I would say, I don't know how to answer your question really linearly, so I'll just try and give you what I would say to someone who I have in the office with me, is often when patients are having a tough time with grief, with psychosis, with anything, often I'll try and scoot them towards a medicine that I think will work, or a therapy that I think will work. And almost always they'll say, I'm not sure, I'll think about it a bit longer. But I almost always tell them, hey, if I had in here instead of you, but my mom were here, my father were here, my brother, my uncle were here, I would give my family the same recommendation. I would treat them no differently. This is what I would want for them, the people that I love. And by extension, where I'm going with this is I want to say, you deserve the same care that you would give someone that you love. It's always important to have hope too, because if you have hope, you can do anything with it.
Finally, what gives you hope when you think about the future of mental health care?
I think that with the dominance of social media apps, TikTok, what else are the kiddos using nowadays? YouTube, what is it? Instagram or Facebook? The cultural shift is real. Everyone is talking about how they may have this or that, a depression or anxiety, and just getting the words out in public makes it less stigmatizing. And so just making it common and okay to say, hey, I'm having a tough time, or hey, I've got anxiety, or hey, I've got depression is super powerful. So I'm loving that is the trend that we're going nowadays, because in the 80s and 90s, we never would have allowed anyone to say this without being branded, an outcast. And I would say finally on that regard, we have so many new things that are coming out. So I'd say in the past, all we had was ECT, but there are so many new evolutionary technologies that I never would have thought years ago that are being pushed now. So people are getting better, and it's exciting to be part of the ride.
And I would say we also have just so many different ways that we can provide treatment, right? So even being able to provide telehealth to individuals. So those individuals who previously may have had a difficult time accessing services now have options that they could use to be able to get those services. And just the fact that we're sitting in this room having this conversation right now is so important, right? These conversations need to be had. They need to continue to be had. One of the negatives of social media is people see a lot of things, and the positive is that they see a lot of things. And these are the types of positive things that they have an opportunity to see. There's a lot of opportunities for education that way as well. And so many of those things are out there.
Great. Well, I want to thank you both very much for your time here in the studio today and sharing all your thoughts and expertise with our listeners.
Thank you for having us.
Glad to be here. Thank you.
Thank you again to Melanie and Dr. Roach for joining us and for sharing their expertise, their compassion, and insight during this important conversation. Mental health affects all of us, and one of the most powerful ways we can reduce stigma is by continuing to talk openly about it. Seeking help is not a weakness, it's a sign of strength, and support is available. At Zepf Center, individuals and families can access a wide range of services designed to meet people where they are, including mental health treatment, primary care, crisis services, substance use disorder treatment, and specialized programs like FIRST. If you've enjoyed this episode, be sure to download and share it. For the latest clinical connections, subscribe on Spotify, Apple Podcast, or wherever your favorite podcasts are found. For more information about the resources mentioned in this episode, check out our show notes. For more information on Zepf Center, visit us at zeffcenter.org or find us on Facebook, Instagram, and LinkedIn. Until next time, this is Dr. Jennifer Jansen signing off.